A federal immigration enforcement operation in Los Angeles turned violent yesterday with a U.S. Marshal and an undocumented immigrant both being shot. The Department of Homeland Security says the immigrant had previously escaped custody and, quote, weaponized his car by ramming it into a law enforcement vehicle during an attempt to flee. Officers responded with, quote, defensive shots, striking the immigrant in the elbow. A ricocheted bullet then hit a U.S. Marshal in the hand. Both were taken to the hospital for treatment. At the same time in New York City, tempers flared as protesters gathered while federal agents carried out a joint immigration and customs enforcement crackdown on illegal street vendors in the city's famed Chinatown neighborhood. The area is known for merchants selling designer knockoffs. At one point, the protesters surrounded the federal agents and attempted to block them from carrying out that sweep. At least one person was arrested for assaulting an officer. I want to bring in senior healthcare reporter for Politico, Alice Miranda Olstein. She's out with a new piece looking at how ICE is hiring dozens of health workers as lawsuits and deaths in custody mount. Talk to us a little bit more about what you found. It's a really sobering piece that speaks to the reality and the impact of what happens once people are actually detained and taken into custody by ICE.
Absolutely. So as you know, we're detaining a record number of people right now. We're detaining people that the government previously didn't think needed to be detained, people who weren't a flight risk, who weren't a safety risk, people with no criminal record, people who were just, out living in the community, waiting for their court date.
Going to work.
We're now, packing these people into facilities, including facilities that were recently created, these tent cities in Florida and other places where it's really hard to control temperatures. It's really hard to stop the spread of diseases because we're sort of overcrowding these spaces as well. And so we are seeing deaths just go up and up and up. And in our reporting, we found that the deaths just since President Trump took office in January are now almost as many as occurred over the entire Biden administration. So we thought it was interesting that right as we're seeing these mounting deaths and an explosion of the detainee population, ICE is hiring dozens of medical personnel, doctors, nurses, pharmacists, therapists, and we talked to a bunch of people about what that additional staff could help and what it maybe could not help address in terms of people continuing to get sick and die.
And so what's the answer to that?
Yeah, so we talked to experts who said, look, it could help with some things like people are always complaining about delays in medication distribution. They're requesting, I need my medication, and they're not getting it. They're going days without it. And that's both for, acute things like a COVID infection or more chronic things like managing diabetes. People have died of both of those things in recent months. And so they said staff could help with that. They could help with taking medical histories when people are first booked. But they said that the fundamental conditions of detention are so unhealthy and so unsafe that it doesn't matter how many people you hire. They're worried people are going to continue to die.
And I think it's important when we talk about the number of deaths so far, the way you compared it was 20 detainee deaths in 2025. So just for this current iteration of the Trump administration. Exactly. Versus 24 over the 4 years of the Biden administration. What does it tell you? What do your sources say about the fact that ICE is looking at this as a problem? Clearly, they're trying to solve for it by hiring medical personnel. Is at any point the question, should we slow down? Should we do less? Are our actions having unintended, very bad consequences? Yeah, so we just saw that they're, hiring these medical personnel, and we don't know when exactly they will hire them given the government shutdown. And so, they're not exactly in a hiring spree right now with the government. But not only do we not know when these people will be hired, but 40-something folks, which is the job postings we saw, that's not that many when you think of how they're trying to expand the detainee population by tens of thousands right now. I mean, it just increased over 60,000 for the first time in U.S. history, and they're planning for the capacity to have, over 100,000. And so people are very skeptical that, these new hires will be able to really make a fundamental difference. Yeah, and what is DHS, what is ICE saying when you came to them and said, I see you're doing all of this hiring?
So they did not respond to any of our questions, but we were sort of able to glean some of their responses from recent lawsuits. So migrants have sued the government, represented by ACLU and groups like that, challenging the what they call medical neglect in ICE detention, people not getting their medications, people not getting injuries addressed, mental health being handled in a terrible way that's been leading to more suicides. And so in response to these lawsuits, basically DHS is saying, conditions are fine, people do get their medications, basically refuting the accusations.
Refuting them, and yet you have deaths spiking.
Right.
So how do they square that circle?
They have not. So I think it's something we have to continue to be on top of. And I think it's interesting that, this is coming also as oversight is being dismantled. Yes. So ICE has tried to get rid of these internal offices that respond to complaints and investigate allegations of abuse and neglect, do inspections. As we know, lawmakers who have tried to go do inspections themselves on ICE facilities in their districts have been blocked from that and turned away. And so there's a real fear that we're detaining more people than ever. More people are dying, and yet we're not having these oversight structures to look into why and how to prevent it.
And there are no mitigation efforts in place, at least not yet. I mean, obviously,
that we know of.
Yeah, at least you're covering what could be one of those mitigation efforts. But I think you're 100% right to bring in this landscape of it's coming at a time when oversight is at its lowest point because the administration is blocking those attempts, whether it's through the Pentagon talking to Congress, whether it's not allowing Congress members to show up to ICE facilities, which is their right as members of Congress to do that oversight, to make sure that things are happening on the up and up. Yes, you can detain people based on the fact that they are in this country illegally, sure. But the way that these people have the expectation of being able to be treated like people, like humans. And when you see these statistics, I mean, this piece is online now. You can read it. People should. I thought it was really sobering, and I'm thankful that you came on, did that reporting, and then came to talk to us about it. Always appreciate it. Alice Miranda Ollstein of Politico. Thank you.